suit, but
Sorry, I forgot to press the record button. So yeah, go ahead.
so we're thinking of perhaps redesigning the PPE that people are using so that it feels to the user that they're as well protected as they would feel if they're wearing a hazmat suit, but it's easier to don and doff. And that would be sort of a design direction for the project. Rather than trying to sanitize PPE, we would just make PPE that's easier to sanitize or less risky to use.
Mhm. And I think, yeah, Ruta, feedback on that is there is a lot of work that we have done on the N95 decon subgroup, which Nicole is part of, and the UVC cabinet has gone very far, which started with Tom Baer at Stanford. Uh, the important bit would be is everybody is trying to solve the problem of what occurs now, but taking a little bit of a longer view might be fascinating to just say that have we fundamentally asked ourselves designing PPE for decontamination? Because right now everybody is documenting that, look, this PPE that gets degraded by this technique, if we had more time, you could redesign it such that it could be used longer. It would be very novel. I mean, I think we have been for the last 6 months in these decontamination discussions, and so far I have not seen any focus on that because the industry has to focus on what comes next as well. And that might be a very valuable contribution.
That
So
was exactly what Nicole said too.
yeah, so this is absolutely fantastic. Amongst all the ideas, this is the one that I would suggest. But then you have to also quantify, choose a process that's most effective, choose a PPE that's most effective, say an N95 mask, and see what degradation happens. Because what you're simultaneously tackling is an environmental challenge as well. Reusability of PPE saves these PPEs from not landing in the ocean, and hence if a PPE was designed to work 7 days, it would be I mean, it's 7x less waste products. So you would have a big impact on other sides of the story as well. Okay, so we're gonna jump because I feel like we're gonna get our rhythm soon. So global epilepsy care.
And
So
actually, real quick before they start,
I'm
sorry,
recording.
you're recording. Okay, fantastic.
Yeah. Okay, Ajay
Yeah, I think
and
Ceci
team.
is here too. And
Hi,
our
Ajay.
other
Ajay,
two, our other two teammates, I think, are asleep, which is which
yeah.
is totally fine. Yeah, so I think just to get to the heart of where our team is right now, we've made kind of a decision to focus more on technological approaches towards expand, like trying to build more accessible diagnostic tools for epilepsy, or monitoring tools for epilepsies or seizure onset. Um, Although recognizing that there is a huge separate, not necessarily separate, but a huge parallel problem space that is about community education, attacking stigma. But I think these things go hand in hand, especially if we can democratize the data surrounding what makes a seizure, that could easily support educational programs. So that being said, I think our goal and the outcome that we're aiming to achieve is a clear understanding on what are the minimum thresholds for the various axes that exist, the various technical constraints that exist to deliver a device that can like be clinically verified to at a similar level to current technologies diagnose epilepsy or detect when a seizure is occurring. That question has so many moving parts, and that's kind of what we've broken down. And we're kind of starting at existing technologies and trying to understand, you know, what goes into a signal that's detecting a seizure, what parts of that signal, and how rich does that signal need to be for a clinician, psychiatrist, epileptologist to say, yes, this is an onset of a seizure, or this is this is epilepsy. And by kind of peeling back down, we hope to uncover that perhaps there are minimums that we can start designing a device for. For example, one of these axes that I think is really interesting to think about is on an EEG. There's a number of electrodes that are used, sometimes up to more than 64 different electrodes on a cap of a skull. One question that comes up is how many electrodes do you actually need to make a clinically relevant claim about whether or not a patient is about to have a seizure or is having a pre-epileptic event. And if we know a minimum number, or we know other things like how good should the electrode impedance to the scalp be? Can it be higher but compensate for more resolution, spatial resolution? The other way around? Could a few really solid electrodes? I think those questions are going to be
So
at the
Ajay,
heart of
just in
the
that
software.
very quantitative space, how does price per channel scale in EEG? I mean, you said 60 channels, and then I could think about 5 channels. How does cost scale with number of channels?
It's a great question. I mean, I don't have anything, like, I think this is another thing that we need to investigate, because I don't think it's as simple as that, because there's so many different form factors for how we put electrodes onto the scalp, right? Like if some EEGs are headbands and they only interface with like the temple or the forehead region of the brain, whereas I think clinical EEGs are a full cap. And so, I mean, if I wanted two really great electrodes in the middle of this hairy region of the brain, that might incur more design costs, right, than something that can just go on bare skin. So understanding all of this is hard, is a lot, and I think that's kind of where if there's any ideas for how to kind of help narrow our search and figure out clearly what are these relationships and these scaling laws in terms of this space. That's kind of like our.
And then CC and Ajay, could you all both comment on the video game discussion we had? Just because that might be a fun thing for everybody here to hear about. You know, the back of the year. Yeah.
Yeah.
Go ahead.
Yeah, there are some commercially available ones for gaming, and we're basically what AJ said, we're trying to tabulate all those in terms of their capabilities and requirements. We're obviously interested in mobile ones, so thinking that there might be a clinical standard, but the cost of isolating, like getting people to a specialized hospital might be too much. So we can do it mobile at home, so they can have longer term diagnosis. Because at the moment, something that happens is that they go in for a test for 30 minutes, and they don't have a seizure during that time, so it's useless.
So I actually spoke to a few clinicians around this issue. Current standards, if somebody has reported and the doctor is trying to understand which part of the brain, the patients are asked to live at the hospital for up to 5 days without their medication. That's a huge cost. I mean, living in a hospital for 5 days and under 24/7 care, because the nurse has to be present in the room at all times if a seizure does occur. So moving that care home, even if the efficacy goes down in a sense, would be a big difference in cost. And again, not everybody can actually afford to stay in a hospital for 5 days. So, I mean, I think it's a big challenge.
Hospital, even to travel there, like from the inside of a country to the national, to capital, whatever.
Anybody knows numbers of epilepsy kind of in the, say, the context? I know there are many folks joining and connecting from India or Africa, and the distance of sort of low and middle income country. What's the epilepsy detection rates right now? Just so that you all, both Ajay and CC and team, you have to put a target. Which population are you designing this solution for as well? So I'm curious, are there numbers on that front? How are you choosing your audience? Anybody else wants to comment also on just epilepsy in the regions that you live in would be useful. Europe, Africa, India.
I could just share from personal experience as a parent. So my son was having hundreds of seizures a night as a 1-year-old, but we couldn't see it during the day. And I noticed that his face would twitch once in a while. I had to really advocate for him to get more than a half-hour EEG test, because the doctors weren't listening to me as a voice, knowing that something was happening with him. And it wasn't until I switched to another doctor that I got a 24-hour one, and he only did it because I had documented a moment on my phone when he, all of a sudden his face seized up and he started doing something called cotton picking, and his eyes bulged. And so there's so many different ways of expressing a seizure. Once they did that test, that 24-hour test, they told me to watch him at night. And I would love a at-home testing device, because I stayed up all night with my hands on his feet and his hands, on his little hands, to feel the tremors, because they were very slight and minor. But I was using my own hands, so how can it be an at-home testing tool? Because the diagnostics itself, just identifying that your child has this issue. And I just felt so lucky because I was college educated. I could advocate and talk with the doctors, but I saw so many people who couldn't. And then also people who had parts of their skulls taken off and the electrodes put directly on their skull, on their brains. And my son would have had that if we hadn't found the tumor, like, because they would know the cause. That's the next step. So
yeah, you know, I think, I mean, it's amazing. So first of all, thank you, Corinne, for sharing this. And then I won't, unless you approve, I won't upload that section online. I think these are all closed door sessions, but again, you know, personal experience goes such a long way in both advocating and understanding these problems. I mean, these are such powerful words. It's amazing, the picture that you describe. So Ajay and Cece, you guys should have a separate conversation offline with Corinne as well too.
Yeah,
Pick her
definitely.
brain on thinking about what as a parent did it mean for her, because you have to choose an audience as quickly as possible.
Yeah, I mean,
we hadn't really thought of that. And Corinne's story was heart-wrenching, and it pointed us in the direction of video monitoring as well. I mean, which is part of what they're doing if you're hospitalized. But it's also enlightening in the sense that you can monitor muscle activity. So thinking about EMG would also be interesting, but that opens up too many avenues again. Sorry, AJ.
Yeah. Oh, you're good. You're good. So I think one of the statistics that jumped out to me when we were first starting this was that 80% of all epilepsy are in low and middle income countries. And so the developed world has a bit of a grapple on this issue, mostly because I think the efficacy of anti-epileptic drugs is really high. So getting people properly diagnosed and then getting their hands on good drugs is really crucial, and that's really usually where the treatment gap lies. And so I feel like our design choices are really going to be focused on the global burden, kind of that treatment gap that exists in low-income countries and low resource settings. But even focusing that even more is definitely should be a goal. And I think getting a we say what is accessibility in those regions, like what is the price point? We need to understand. We don't have a huge background in our group either, so other people who maybe, you know, we really benefit from some expertise on people who have, you know, like deployed technology in really low resource settings, and kind of what is
one
that?
Of the threads that I'll also do is offline is we'll connect a neurologist, say in India or another place, just to get their viewpoint of what cost
in
barrier.
India, actually,
Go ahead, Frugal.
Yeah. So in India, the overall rate is around, it says it's around 5.59 to 10 per thousand. But some states like Kerala, they report a rate of around 4 per thousand. So this varying number is due to like some states are majorly farming states. So they are not educated enough to realize that this is what this condition is, or this is what is happening to my child. So if they don't, the parents or the family doesn't itself know about it, there is no situation to diagnose.
And I mean, Raghav also mentioned in the chat here, there's a huge stigma associated with reporting epilepsy too. Especially, I bet in middle income countries, this is probably like one of the biggest regions, one of the biggest problems here. So,
and also, like, most people don't what do I say? They have it, but they don't have an episode because in like rural regions, there aren't many factors that would trigger an episode, basically. So they just have it and just live their life about it.
Yeah, for me, it's such an interesting problem because part of that social stigma that exists is really, I think, draws parallels to things like depression and anxiety, where they can remain hidden for the person. It's not immediately apparent. Just because epileptic episodes can happen super randomly. But unlike depression and anxiety, there are somewhat clear non-invasive imaging techniques for us to tell us whether or not this is happening. So I feel like that's kind of where
I think this is also at the heart of
another point,
the right scale of the problem. Go ahead, Prajal. Yeah.
Another point is the cost, as Manu was mentioning. For example, the deep brain stimulation for epilepsy, it starts around 6 lakh rupees. which is around the average annual income for a Indian person.
Yeah.
Like for a middle class family, 6 lakh is the average income for
I
a
mean,
middle class.
those types of therapies are usually for like very drug resistant epilepsy, which does exist. It's definitely a problem, but that's probably not the kind of, we're not anticipating. I don't even think we're really looking at treatment as an option, right? Because there are like most epilepsy. I think it was like 70% of all epilepsies, like the World Health Organization estimates 70% of all epilepsy can be eliminated or treated properly just without huge surgical intervention.
Yeah. Okay, so we're gonna jump to next teams. Team Pepperix, hardest challenges. Have you identified an audience, and how can people in the community help?
Yeah, so since the last meeting, we actually had an idea on what disease to focus, and that we took as schistosoma. That's a blood parasite which is creating a havoc in sub-Saharan countries, basically Africa and all the neighboring countries. So we are actually working on a paper-based design to actually filter out the parasite's eggs from the urine sample.
And I want to emphasize it's a little bit interesting because it is really in that same sample preparation part of the challenge again. Going back to diagnostics that we had said, focusing on sample preparation. Yeah, go ahead.
Yes, so with Corin's help, we are actually, Corin has actually designed this filter, which is based on a coffee paper mug.
So Corin, do you want to share it? And then we could, I think one thing that would be valuable is to rapidly ask yourself, how would you evaluate, because now you guys have pinpointed, how would you evaluate success of your current designs so that you can reiterate?
Yes, for that, we actually are planning to create a model for urine, like a synthetic urine. We have come up with an idea for that. And we are actually thinking about now how to replicate the Hellman's eggs. And as you suggested, coffee filters, ground coffee filters, we can use. So that is one part that is done. Now the problem is we are actually thinking about how to filter out these eggs. So we are now focused on how to design this, and we need to further focus on that problem in depth. Yeah.
Corinne, do you want to just quickly show people what you've been working on? I'm actually realizing that it might be fair to, rather than rushing and going through all the teams, this is so valuable that, of course, this is what we will do on a weekly basis now, that the rest of the teams we will pick up on Thursday, because this is really where lots of ideas and brainstorming happen. So rather than rushing it, let's take the time. And I'm hoping that everybody else who's not in the team finds value in it, because of course, we want everybody's brain. You can contribute to other people's ideas and push those teams as well. Go ahead, Corinne.
Yeah, so Arvind, while I'm sharing, do you mind putting into the chat our Notion methods page?
Or I can just share my screen. That would be
great, yeah.
Yes, I'll share my screen.
Yeah, so we're exploring with paper compliant mechanisms, like how we might create trap areas. And I think one of the challenges, I'll let you drive that. So we luckily had a conversation with Manu last week where he said, when you're focusing on this project, maybe anchor in on the collection, the filtering and the collection. We were initially thinking about microfluidics, but if we're looking at the volume of the urine sample we want to look at, it's not micro, it's larger. So
10 ml is a typical volume.
Yeah, so and then you suggested like coffee filters, and then we started looking at disposable coffee filters and how can we do something that's made of paper. So one of the challenges is if we want to have a seamless system where we can collect the eggs, pour urine into, so just really imagine doing your coffee, it's kind of gross, but imagine putting this coffee filter device into a cup and you're pouring liquid in, and it's not coffee, it's urine, and you're saving that coffee filter insert, which will become a slide mount possibly. How can that insert have some oil added to it or something that makes it translucent so they can be looked at under a foldscope. So our challenge is like figuring out what kind of oils we can look at. What are the different materials? Is this going to be multi-material? How do we effectively create a catchment for the eggs where we can predict where they're going to be? And then have a process where we turn that paper translucent so that you can image with it. And all the while keeping yourself safe because you're collecting these live eggs. So yeah, a lot of challenges.
Yeah, no, that's a fantastic description of the honing in on those challenges is so critical to evaluate your designs, because there is the collection side and there is the detection side.
Can you go into a little bit more detail? I'm pretty curious about this just because I've worked with some filter and...
Do you want to unshare your screen, Arvind? Yeah, just because it's easier to have a discussion. Go ahead, Ajay.
I'm a material scientist by training, and I used to do some work with like porosity and filters. And I think your question about how do you engineer an optical property into this is really, really interesting. But can you tell me more, like what exactly are you screening for as the urine goes through the coffee filter material?
Yeah, great question. The eggs, yeah, for the disease. And I can't even pronounce it right. I'm not a scientist, so Mani, how do you say it?
So, I can do that.
Yeah, thank you.
So, we are actually
you can just say bilharzia, right?
Yeah. Go ahead, Arvind.
So we are actually focusing on how we can dip that particular filter in an oil, say for coconut oil, and the paper becomes translucent totally. And only when you see through a microscope, only the eggs of the helminth is visible. So
I'll
you
describe
actually
this.
find
One of the origins of this also comes from, we did this screening in Ghana, and one of the challenges is there are lots of materials that you can filter because these eggs are big. I mean, we're talking about 200 microns. But then when you, whatever filter material you use, if they get embedded in it, it's not optically clear. So it's a very interesting challenge because the microscopy is available, many filtration materials are available, but you have to make sure that an embedded egg could actually be tracked. So have you guys started adding oils to materials to see what it does to its optical properties? Okay.
I have already done that. So I have actually come up with coconut oil was one option, which I saw that the paper became translucent.
Yeah.
And the other one was, I think...
and just for people who are thinking about the physics behind it, is you are reducing the scattering surfaces. And as long as your refractive index is similar, you can turn many things to be far more translucent.
And so as our distributed team, I'm now going to take his studies and I'm going to try it with, taking sections of a mask.
Yes.
HEPA
second life for surgical masks.
Right. Tea bag, coffee filter, and paper towel. And so just trying to figure out how do we do this in a distributed manner across continents? So we're looking at what each other's doing and then like kind of trying to replicate with additional materials and yeah.
And I think this is a good example. I know many of you asked how to work across continents. So just learning from these types of tricks, one person does the experiment, other people replicate it. You should not shy away from physical prototyping, even wherever you are. This is the beauty of Frugal Solutions, that you should, yeah.
I just seen that there was a comment about coconut oil solidifying at room temperature. So I went to the store and got some. It's a solid jar, so I don't know.
Yeah, it is. Yeah.
I'm not sure about that, but yes, that is one problem that will be faced during winter season. Agreed. Thank you for telling me that.
Yeah.
Actually forward.
What usually goes in the fold scope when you image?
Oh, you can just put a normal slide. You can adapt it to mount to any kinds of samples. So the idea would be is there would be a type of a slide that would be closed that just enters, just like a normal slide.
Yeah. So, but it's got to be like this a transparent slide kind of.
No, it doesn't have to be. We can also do reflected. I think transparent is interesting because if the eggs go deeper in, then when I imaged it in the past, I think there is a paper that we wrote on this almost 7 years ago. The number of eggs you can identify is smaller because only the surface eggs is what you can see. So the goal of going deeper is actually very valuable. Okay, so let's do one more team. Arani, non-plastic syringes. Arani and Pankaj and everybody else.
Yeah, so we were working on the plastic syringes problem and how it could expand a lot after this pandemic. And maybe I could share my screen for a bit.
Yeah, you have full control.
Yeah, sure.
Is
Perfect.
this visible?
Yes.
Yeah. Pankaj, are you here?
Yes, I'm here. So
Yeah,
I
you
was,
could take it up. Yeah, great.
Yeah. Go ahead.
so I was wondering about if I can share my screen so that I have.
Oh, cool.
Yeah.
Then I'll stop sharing.
Arani has to unshare and then share.
Perfect. Thank you. So,
You're welcome.
can you all see my screen?
It's loading. Yeah.
So we started with the challenge of non-plastic syringes, and we have this Google Doc where we were documenting what we were discussing initially, and then so we have documented main questions. We have what possible solution we can have. For example, biodegradable syringes, and then needle-free jet injections, or if we can change the design of syringes so that we can minimize the disposable waste. So we have created a Notion page here. We have literature, and in the project direction, we have divided our team into, so we are 6 members, and we have these 3 subsections or sub goals. So we have divided 2 members uh, per goal. So one is biodegradable materials. There are few patents on that. So we are reading literature on that, and I'm not sure. Okay, so I think Ravi and Avadut are working on that. So we are documenting the literature which is available on the biodegradable syringes. And the second is changing the design, reimagining this syringe. If we can, as I said, minimize the disposable part of the syringe. For example, the needle and some front part which can be dismantled, and the barrel or the and the plunger can be reused again and again without cross-contaminating the syringe. And the third part is needle-free injections. Me and Ernie are working on it. So there are many different techniques. For example, microneedles, jet injectors, iontophoresis, sonophoresis. There are a lot of techniques, but they have their own problems. So
just a quick feedback on it. I think one of the things would be is it might be useful amongst the 3 to choose one and focus all your 6 team members' energy in one challenge or one, because it's perfectly okay to find out that either this space is too crowded or just doesn't have the right legs. You would have still proven something, because I think I'm a little bit worried that if you dilute your efforts, and I think amongst all of those threads, internally going out and doing survey, but then meet as a team to see as a team, could you coalesce amongst these 3 ideas? Could one of them be picked for the next couple of weeks, just in terms of pushing on one idea?
Yeah, exactly.
Yeah.
So we have a team meeting tomorrow. So we decided to give it a week to read the literature and
exactly.
to
You want
check
to diversify, but you have to converge.
So yeah, we'll be
amongst everything
choosing.
I heard, and then if you unshare your screen for a second, I'm just also curious other people's experiences with syringes. I think with the biodegradable materials, you would find that it's just a choice of materials. I really liked what you said of reimagining a syringe, which is where some components of the syringe can keep reused, while there is something that just has to be, because that is thrown away because it is sterility is a key criteria. And often enough, I mean, in old days, boiled water and when I was growing as a kid in India, I got injections with glass, and you would go to a doctor's hospital and they would have a boiling water in their table. Many of you know this. And it was quite scary sometimes now when I learned about all of these viruses, that the fact that there are no other viruses spreading because somebody forgot to turn that boiling pot on. And But what you said, I have never heard before in that explicit form of you break a syringe into parts. There's so much beautiful mechanics in there. And there's only one thing, which is needs to contact with the fluid. So could there be,
Exactly.
I mean, I absolutely love that. Any comments on syringes and other feedback for the team from other folks? Kevin, other folks, anybody who is, I don't know if some of you are doctors. And I mean, the whole notion that many doctors in many countries actually get diseases because of accidental injuries as well. And of course, when you start thinking a little bit about the contamination issue around needles, it's a huge issue even in all kinds of places. So comments?
I heard it's not like on the health particular world, but as far as I'm concerned with dental toothbrush, there's also a lot of initiatives to start reducing the plastic on the part that you take to brush your teeth. Yeah, I have no idea the word, but the part that actually goes on your teeth is like the one that must be kept. So it's only a matter of redesigning the structure and like making this sort of Lego parts and what can you reuse and just like start reducing the parts that you are using. So yeah, maybe not in the syringe world, but there's a lot of initiatives on another objects as well.
Any other comments and feedback to the syringe team?
Yeah, like one point after Pankaj. The thing is that there was a team in Georgia Tech and they were working on microneedles and they discovered this dissolvable microneedles that could actually dissolve, and what was remaining was just the surface and you could just throw it away as a paper. And there was like no disposable waste. Like the entire thing was purely biodegradable. But the thing was, I think there is no proper like manufacturing technique which can be scalable for this. I think that's one.
Yeah, and I think focusing on the manufacturing side of that would be a fascinating challenge. It's a tough one because by definition, these needles have a certain size. But on the other hand, it's actually a really viable one if you do choose that. Any comments on that? I think also,
I had one.
Yeah, limitations around volume is something to be considered too. Go ahead, Prajal.
Yeah, so I have interned in a diagnostic lab. So as you said that even doctors and even clinicians, they even get diseases while doing the tests. So I saw that most of the people who got hurt with the needles, the doctor's part, it was while disposing them or while carrying the disposed needles. So my question to the team is, even if your needle is, what do I say? It comes apart and you can reuse the stuff. How will you handle the disposing part? Will it be biodegradable or how will that be handled? Will that need a separate unique toolbox? Like, I don't know.
So generally the needle is made of stainless steel because we need, so it should be stronger. It should not break inside your skin. So that's why stainless steel. And there are proper guidelines, how to dispose it in shops and, how to disinfect or sterilize it and then dispose it, maybe incinerate, or, it can go to landfill as well. But there are proper guidelines on that.
And there is also there is one very famous product which is, I think, has WHO mark on it as well, on one-shot needles, that after the needle has been used, it locks in a manner that it's not accessible. Very clever, very simple design that led to, I think there is a big push. The challenge here is that the markets are such that many countries, the adoption has not been so rapid. But still the problem remains that majority of the needles and these one-shot products are all plastic. So I think,
Exactly.
Okay, so I think the breakout rooms are ending. It's 1:40. I have the list of teams that were not able to present. We're going to do that on Thursday. And we'll just do a 10-minute debrief. So we go back to the main session. See you all there.
Perfect. Thank you.